What we can offer sometimes is a technology that's not available elsewhere. Some people use the term baromedicine as a specialty of medicine that deals with the application of gases under pressure. I like to define a problem wound as a wound that doesn't heal like it should. But a common denominator of problem wounds is they're all oxygen deprived. Oxygen is the fuel that powers all living cells. And various cells have a greater demand for oxygen than others. The treatment for carbon monoxide is 100% oxygen. Number one, get them out of the environment where the carbon monoxide occurred in the first place, but and then 100% oxygen. It appears that through some studies that have been done in Utah, that the use of hyperbaric has enhanced outcomes over just the application of 100% oxygen by face mask or non-rebreathing mask, and that there's less problems afterwards, perhaps even faster recovery. So the use of hyperbaric for patients overcome with carbon monoxide intoxication is somewhat the gold standard for the treatment of acute carbon monoxide intoxication. What we do is the ability of hyperbaric oxygen to reverse the vascular injury associated with radiation. Radiation is one of the mainstays of cancer therapy and cancer protocols. But radiation, the whole purpose of radiation is kill cancer. But like everything in life and everything in medicine, you get some bad with the good. And one of the consequences is that radiation can be quite injurious to the lining cells of blood vessels. And when you harm these so-called endothelial cells, they scar down, and you get what we describe as an obliterative vasculitis. You literally wipe out the micropipes in a zone radiation field. And if there is an obliteration of the vasculature, you have no way to bring oxygen or antibiotics or glucose or insulin or growth factors or anything it takes to heal. What hyperbaric seems to be able to do is, because you can profoundly increase total oxygen pressure and concentration with a course of treatment, you can reestablish that vasculature in an area that has been there's been significant obliteration of the vascular bed, and probably restore it to the tune of 85 or 92%. Well, this is our Sechrist 3600 unit. It's the biggest one that we have. It works by flow, and there will be somewhere between 300 to 400 liters of oxygen that is blowing into the chamber, which then has a restricted outlet, and that's how pressure is increased within the chamber. So the patient is entirely enclosed, and what we have here are monoplace chambers. They're about the size of the old iron lungs, about 44 inches wide, 8 feet long, clear acrylic plastic, and they'll lay on a gurney with pillows, and they'll be slid into the chamber on a gurney, and then the door is closed, and then oxygen is allowed to flow and pressure is increased, but it's 100% oxygen, and with breathing this 100% oxygen, you get higher concentrations in the blood, and accordingly higher oxygen concentrations in the tissues. And there's a communication system that we can talk to them if necessary, tell them what to do, provide them any instruction, et cetera, et cetera. Probably the symptom they experience most, it'd be some pressure on their ears, as one would experience as they're flying on a plane. But to help them occupy their time, they can watch TV, watch sports, they can listen to music, but the total treatment time within the chamber is 2 hours, and a treatment is at pressure or at depth, if you will, for 90 minutes. And then it takes about 8 or 10 minutes to get down to pressure and 8 or 10 minutes to come back up again. It's a very gratifying to see a limb saved, a patient saved, and the gratification. The patients really are most appreciative.